Hi everyone, I am Beatrice. In this video, we'll be looking at hepatitis, particularly viral hepatitis. We'll be looking at the causes, the signs and symptoms, and the treatment options available. I'll also be highlighting some points you need to take note of for your nursing school exam and for your NCLEX. So stick around, let's begin. Hepatitis simply refers to the inflammation of the liver. It can be either acute or chronic. There are several causes of this condition, but the major cause is viral infection. And this viral infection, that's where we have the viral hepatitis falling under. So we have hepatitis A, B, C, D, and E. There are other viral infections that can also cause hepatitis, like cytomegalovirus, even Epstein-Barr virus. They can cause hepatitis. Another cause is toxic substances like ingestion of alcohol or some drugs that are toxic to the liver. Then we have autoimmune disease. Autoimmune disease means the body trying to fight itself. Now, with any of these causes, it can lead to inflammation of the liver, and those hepatocytes, the liver cells, can be destroyed in the process. The liver play a very important role in the human body. It functions in metabolism, in storage, and in production. I discussed this extensively in my former video on liver cirrhosis, so you want to check that out. Now, for the signs and symptoms of viral hepatitis, it comes in different stages. I'll discuss that shortly. But generally, the signs and symptoms begin with anorexia, nausea, vomiting, some abdominal discomfort. The patient may be feeling fatigue, tiredness, and weight loss may be evident. Then jaundice may begin to show forth as it progresses due to accumulation of bilirubin. Pruritus, due to that same bilirubin accumulation, the patient may experience itching. There are other signs and symptoms like fever, the urine becomes dark, and that is because of the presence of the bilirubin in urine. These two may be clay colored, and that is due to absence of bilirubin in these two. And then joint pain, that's another one that is evident. All these signs and symptoms can be classified under three stages. Now, the stages of viral hepatitis are three. We have the Preicteric phase, also called prodromal phase. We have the Icteric phase and the Posticteric phase. The Posticteric phase is also called the convalescent phase. Now, from the word icterus, it has to do with jaundice. So when we say Preicteric, we are saying before the appearance of jaundice. The icteric would be the phase where there is jaundice so obvious in the patient, and the posteric when the jaundice begins to subside. You need to take note of this. You can see that in the select all that apply for your exam. Now let's look at it gradually. For the pre-icteric phase, which is the prodromal phase, and the patient will just be feeling some symptoms that may be common with other disease conditions. They'll just say, oh, I feel nauseous, no appetite, joint pain. So those common signs and symptoms, the patient may be feeling that. Also, when they do some lab tests, they may discover that the AST, the ALT, which are the liver enzymes, will be high, and also the bilirubin will be high. The second stage is the icteric stage or the icteric phase. At this phase, that's where the jaundice is so obvious. Now, at this stage, the patient is going to show the sign and symptom of jaundice. So there'll be yellowish discoloration of the skin and the mucous membrane. These two will be clay colored. The urine will be dark or tea colored. Also, all those liver enzymes are going to be really elevated. Then the post-icteric phase, this is when the whole thing is beginning to subside. So jaundice is beginning to wear off, and also those stools begin to return to the color, return to normal, the urine may be clear, and then the patient, all those signs and symptoms, the patient may not be feeling any of those things again. However, take note, that doesn't mean when there's no more jaundice that the patient is free of the hepatitis. In some patients, they may not even manifest jaundice, meanwhile they are still having hepatitis. Now let's look at the types of hepatitis in details. We have hepatitis A and E. I'll combine them together because they have similarities. In fact, almost everything about them is the same, just few things that are different. So the A and E, they are always acute. It starts suddenly. When the patient gets it, it's just self-limiting. It will wear off with time, with support, and the patient recover fully. Transmission is the same for these two types of hepatitis, is oral fecal. So when you think of anything mouth and the anus. That's how they get this diagnosis. For hepatitis A, the to diagnosis is hepatitis A virus antibodies when they do the test, and then they can also do immunoglobulin M and immunoglobulin G. They do this test also. For immunoglobulin M, it is to diagnose if the patient is having the hepatitis A infection at that moment. But for immunoglobulin G, is when they've had it but it's no longer there. But it shows that they've had that history or they are not immunized to it. So to help you differentiate it, the G stands for, like, think of gone, meaning it's no longer there. They once had it but it's gone. Why for the M? If you know that the G is for gone or is no longer there, then it means the M is when it's really active. Hepatitis E is also diagnosed using blood tests, and they will discover hepatitis E virus antibodies. And they also use the immunoglobulin G and immunoglobulin M to also diagnose, to know the state of the infection, whether they are still infectious or is still current, they still have that infection, which is the immunoglobulin M, or they've had it before, but now they are immunized, or they've had it in the past. That's for the immunoglobulin G. The treatment for hepatitis A and E is just supportive care. You treat it symptomatically. If they are nauseous, they can give them antiemetics. If they are having any itching or any kind of discomfort, they can give them antihistamine. So you just treat it symptomatically. You support them. It is self-limiting. It will go, just a matter of time. It's going to wear off, and the liver will recover. Vaccine. So for preventing hepatitis A, there is vaccine available. It's called hepatitis A vaccine. And also there is immune globulin. This immune globulin is for pre-exposure prophylaxis and post-exposure prophylaxis. So when you give it to a patient, either before they even had the infection or they are at high risk of contacting hepatitis A, or maybe they've been exposed to the virus, you give it as a post prophylaxis to prevent them from having it at all or reducing the extent of the illness. For hepatitis E, there is no vaccine. So the only way you can prevent it is your proper hand hygiene, making sure that you're not eating contaminated food or drinking contaminated water. Now let's look at the other type, hepatitis B, C, and D. These ones can either be acute or chronic. In the acute state, it's just self-limiting, but at times can progress to the chronic state. Also, the transmission mode is the same. It's through blood, through sexual intercourse. For blood, it can be through blood transfusion, it can be through piercing, tattoo, even use of those people that use commonly those people that use drugs, IV drugs, where they inject themselves. Now, let's look at hepatitis B and D. If you don't have hepatitis B, you may not have hepatitis D because it depends on hepatitis B. And that means if you are immunized against hepatitis B, you are safe, you won't be contacting hepatitis D. So hepatitis B, the diagnosis is through hepatitis B surface antigen. For hepatitis D, it's through hepatitis D antibodies. There's vaccine for hepatitis B, and once you take it, you also immunize against hepatitis D. Now, the drug therapy for hepatitis B, the antivirals, we have alpha interferons. Example is Pegacy and Peg-Intron. We also have the nucleoside analog, like Hepcira. For prevention of hepatitis B is through vaccination, and also there's also immune globulin, just like for hepatitis A. So this is also for pre-exposure prophylaxis, and it's even the immune globulin is more useful for post-exposure prophylaxis to give the body kind of a passive immunity, so that either to prevent the person from getting the infection or limit the extent of the illness. So we look at hepatitis C treatment. The drug therapy is ribavirin and Peg-Intron. No vaccine for now. There's no vaccine available. So you still just usual prevention method of being careful not to come in contact, through blood or sexual intercourse. You have to use protection. Other laboratory findings, generally for hepatitis, viral hepatitis, or any kind of hepatitis, you'll be seeing that when they do blood tests, the liver enzyme, the AST, ALT will be elevated. Even bilirubin level will be high also. Diet in managing hepatitis generally, the carbohydrates, the carbs, and the calories should be high, but the sodium should be low because in most cases, especially in terms when there's complication, they may retain fluid, there will be edema. So because of that, we want sodium to be low so that they don't worsen, it doesn't worsen the fluid accumulation. Protein should be low also. Reason being that the byproduct of protein breakdown is ammonia. And the liver helps in detoxifying ammonia so that it can be excreted by the kidney. But when there's a problem with the liver, where the liver is inflamed, is not able to do proper job, the ammonia may be high. So because of that, we give them low protein. Fat also should be low. There should be no alcohol because alcohol is one of the toxic substances that can destroy the liver cells and cause hepatitis. Complication of hepatitis can be ascites. That will be accumulation of fluid, especially in the abdominal region. There's also peripheral edema, and that's because of problem with albumin. The albumin is most times low and it's not able to maintain oncotic pressure, so fluid leak out into the interstitial spaces. Hepatic encephalopathy, that is due to accumulation of ammonia. So when it gets too much, it becomes toxic to the brain and it can lead to this emergency hepatic encephalopathy. We have varices. Varices have to do with inflammation or swelling of the veins, and this can lead to it can rupture and cause bleeding. So patients with hepatitis, they are at risk of bleeding. We limit activities for them. Anything that will put pressure, we want them to avoid because they may bleed easily. Cirrhosis is another one. Look at cirrhosis before, where the liver cells are replaced, healthy liver cells are replaced with scar tissues. Another one is liver cancer. And then we have hepatorenal syndrome. This one is where the kidney becomes involved and the kidney can experience failure. Now, to manage some of these complications, in case of ascites, swelling, edema, they can do paracentesis where they do some procedure, remove some fluid in their abdomen to help them breathe better and to promote comfort. Another management for hepatic encephalopathy, we give them a lot of lactulose to remove that ammonia. And when they remove the ammonia, the consciousness return, the patient begin to function better. They may do transplant, especially if the liver cells is cirrhosed and is just there, it's filled with scar tissues, it's not functioning properly. The only option then at times may be to do liver transplant to replace that liver cells. So that wraps us today's topic on viral hepatitis. If you find this video helpful, please like, share, and subscribe for more educational videos. Thanks for watching.